And return to the issue of mental health. It's been a day since investigators revealed a young Greenbrier County mother blamed depression as the reason she murdered 5 children and then took her own life. Today, our Tierra Brown talks with a mental health professional about what, if anything, can be done to help people to get the help they need to prevent another tragedy.
Mental health is not to joke about or taking lightly. When someone begs, pleads, cries out for help, please help them. You just might save a life or more lives. Thank you. And again, initials OAM.
Those initials, read by Greenbrier County Sheriff Bruce Sloan, belong to Oriana Antoinette Myers. Myers murdered 3 of her own children and 2 stepchildren December 8th. Shooting each with a shotgun, she had to reload after every shot. The oldest was 7 and the youngest was 1. Her confession letter blamed her depression. We asked Sheriff Sloan about Myers' claim she'd pleaded for help.
You have to get help. You can't, if there are issues, you can't let it fall on deaf ears. You have to seek help.
A Beckley mental health advocate and psychologist says there's a lot of resistance when it comes to getting that help. Dr. Chrissy Dumas says getting people to understand depression is a chemical imbalance is a huge first step.
There are 3 neurotransmitters that are known to affect depression and mood: norepinephrine, serotonin, and dopamine.
Dr. Dumas says there are signs to look for if you find yourself questioning your own mental health or the mental health of someone you care about.
Changes in routine or a loss of interest in activities that were once very exciting to us. Sleeping too much or not sleeping enough.
Dr. Dumas says taking steps that lead to getting help isn't easy for everyone.
You know, I see a lot of people commenting, well, why didn't she just get help? Well, did she know where to get help from? And if she knew where to get help from, was it affordable?
She points out that though she never turns a patient away, not every facility operates that way or has the means to, and that without the proper insurance, being turned away or given limited services can be a reality for many.
So if you have 8 sessions that your insurance is going to pay for, and you have, major depressive disorder, things are not going to abate in 2 months.
Dumas says Myers' case underscores the need for action to make sure everyone can have access to mental health services.
One of the things that we have to be very cognizant of is that we have to press our legislators that when there's time for funding to be cut, it does not need to be mental health.
Here for you, Tierra Brown, WVVA News.
All right, thank you for that report, Tierra. We're posting some links to mental health resources. Just head to our website. It's WVVA.com.